Hey, what's up, everybody? I am very excited to share this episode with you. We're going to talk about rebuild, don't replace, what the future of healing looks like with regenerative medicine. My name is Dr. Brady Wirick, and I have spent the last 20 years practicing chiropractic, functional medicine, functional neurology, and regenerative medicine. I'm very excited to share with you what the future looks like when you give the body what it needs to heal itself naturally. This whole process started with me several years ago with a very personal story with my own dad. That is him in the back of the boat in the orange jacket. Fishing is one of my passions. It's the whole reason why I live in southeast Idaho. That's another story for another time. So Dad was scheduled to have both of his knees replaced at the time that we started this. And long story short, he was the first patient that my medical team that they injected, and he saw a phenomenal result. He canceled his knee injections, and he literally took his knee, he canceled his knee replacements, and he literally took those knees that were about 80% better to his grave several years later. So unfortunately, we did lose him back in the end of 2021, but he got the last few years of his life with a lot less knee pain, a lot more mobility, and being able to do some of the things that he loves, including fishing. Okay, so what if I told you though, what if I told you that surgery is not your only option? Unfortunately, with the system the way it is now, it's drugs, then shots of cortisone or steroids, and then if that doesn't work, you got to go get a replacement. That's what we're told. That's what we think is the only option. But Gary here, you can see Gary is not a young man. In fact, he is pushing 90 now. He did not want anything to do with surgery. He loves to hunt. He wanted to keep hunting. And so we injected his knees, and we've kept him from having to have surgery, and he's still out doing the things that he loves, because your body actually has the ability to rebuild itself when you push it in the right direction, regardless of the age that you're at. So in this episode, we're going to talk about the regenerative therapies that are really remapping and reshaping the future of medicine. I'm excited to share this with you. Now, bear in mind, if the condition that you have starts with the word itis or osis, and we can put a needle in it, we have a good chance of helping it. Okay, this picture that you see here, the gloved hand, that is our nurse anesthetist, Corey, and he is injecting that thumb, the base of the thumb right here in that little tiny joint. So if we can get a needle in it, a good chance of helping it. Excuse me. And that's what that patient experienced. So let's talk about why the medical model is failing where it's at right now. Okay? Cortisone shots and steroids do offer short-term relief. However, we call cortisone or steroids the fast track to joint replacement, because they actually wear the tissue down over time, and they increase, every time you do those, you actually increase the chances of other things happening. And I can't tell you how many times I've talked to patients who had a steroid injection and their diabetes started after that, which it doesn't cause diabetes, be very, very clear about that. It just was enough, that blood sugar surge that you get from cortisone was enough to push them over the edge. We see it happen all the time. NSAIDs or non-steroidal anti-inflammatories like ibuprofen, they're going to manage your symptoms, but not the actual cause. Plus, there's other issues that they cause, problems in your kidneys and liver later down the road. And unfortunately, with surgery, we often see this where it's either too early and the patient, has problems down the road from that, or they do it too late and there's some major complication that actually disrupts the actual quality of life. And unfortunately, in our system, pain management means profits, and they make a lot of money from this. They're not interested in actually maintaining or healing. They just want to keep you coming back for more. So what is regenerative medicine? Regenerative medicine is the process of actually stimulating your body's own repair mechanism. That's exactly what Glenn did here. Glenn is one of my friends that he works for the power company here in town during the week, and on the weekends he is a crew chief in a Black Hawk helicopter for the Army, and we injected his shoulder, his arthritic shoulder. He actually did phenomenally well and has come back, and we've actually helped him with other joints as we've gone. But this is non-surgical, it's minimally invasive, and when you use here's the secret sauce: when you use biologics, the right biologic in the right area that's where we're getting these massive results that we're seeing. So starting with the secret sauce, I'm going to tell you about my friend Pat here. Pat, we injected her hip with stem cells about 7 years ago, and she kind of fell off the planet. Like I've heard of her. I know some of her family, and I heard a little bit, but out of the blue, she called me the other day, and she says, man, my hip is doing awesome. I just want you to know that. And it's the stories like that that keep me going. But anyway, platelet-rich plasma is the first step. Then we have the umbilical-derived tissue products, which are stem cells and what are called stem cell exosomes. So like I said, the secret sauce is when you use the right biologic, and there's different scenarios where you would use one or some of these. You put that in the right area, and the results almost become unstoppable. So PRP, that is a process where we take your own blood, we spin it down in a centrifuge. So you see on the screen here, that's my thumb, and just above my thumb, all that dark red, that's red blood cells. The white part is a waxy filter, and then on top of that, yellow, that is your plasma. The white thing in the background is a centrifuge that blood has been spun in, and then we take that yellow stuff and inject it back into the joints, and it concentrates your own growth factors and cytokines to stimulate healing. Then we have stem cells that again come from a donated umbilical cord. They are actually signal cells, which is opposite what we used to think. We used to think that stem cells were these undifferentiated cells that actually became other tissue. We now know that's false. They are stem cells that release signal molecules that tell your body to regenerate new tissue. And they are FDA regulated, FDA vetted, but they are not FDA approved. There's a big difference there. And then we have exosomes, which is the actual signal molecules from the stem cells themselves. So they're super, super concentrated, very highly anti-inflammatory, and have a huge regenerative effect as far as telling your body to get going during the healing process, regardless of your age. And the cool thing is, when you use these umbilical cord processes, which are donated material, healthy moms, healthy babies, they're screening processes to make sure that the disease, if mom has a disease process, it's not going to well, she can't donate actually, but just to make sure we don't get the dreaded gumbo going from baby to mother in that process. We take that cord and put it into you. You're not going to get the dreaded gumbo. Okay? They're all filtered, they're all clean. We use labs that are on the up and up with the FDA to make sure, and that's how we've stayed ahead this entire time that we've been doing this. So that's how those work. Let's bust a few of the myths. You guys remember that show Mythbusters from way back when? PRP, let's be clear, it does not contain stem cells. There are articles that prove that. It is growth factors and cytokines. PRP is very much limited to your age. So if you're over 50, let's not talk about PRP. Let's talk about the other stuff. If you're under 50, then PRP may have a chance of helping you, but it does not contain stem cells, and neither does bone marrow aspirate. That's BMAC. Those also don't contain them as well. Bone marrow, quote unquote, stem cells. The people that have done this have been on the attack ever since guys like me have come along with the umbilical cord cells. But we now know that these bone marrow stem cells don't even contain stem cells, and they're actually very, very age dependent. So the older you are, the less likely it's going to be to help you. So what we find is they just become overpriced and they underperform. Okay, umbilical cord tissue does not mean unethical sourcing. We are not using human embryos. This is not aborted fetuses. This is coming from donated materials that are clean, that are vetted, that are here from the somewhere here in the U.S. That we transfer into you to get that healing process going in the right direction. Now, the other part of the secret sauce is, where do we put it? Well, we use guided injections. We want to make sure we are getting it right where we want it. So we use ultrasound guidance to make sure we're getting it in the right tissue, the right joints, the right ligaments. That's exactly what's happening in this picture here. That's Corey, our nurse anesthetist. That's his screen up there that you see. You can actually see his face in the screen. But he is making sure that needle gets right to the right spot where we need it. And the other thing that's cool, MRI is still the gold standard. But MRI is, we take an MRI tomorrow, we might get to the injection on, Friday of next week. Well, we're still looking at information from last week. With ultrasound, you're looking at it right then. That way we can pinpoint where the inflammation is, we can pinpoint where that needs to go. And so that way we're not guessing, we actually guide it. And then having a whole food diet is also going to be a big part of it. Okay? So if it's not a joint that we're working with and we want to deal with systemic inflammation, then we're going to talk about doing either an IV or nebulized stem cells, or both. We may take both and nebulize one, do one into your veins just to take care of systemic inflammation. Exosomes, when you do that, it supports whole body inflammation. Doing it through, if we nebulize it, we're actually targeting your brain, your lungs, and your immune system, because you're breathing it right through your nose with that nebulized device you see there. And you're also, that's my hand sticking there in the picture. That is low-level laser that you see that's going, so it's photobiomodulation for the brain. So we're activating this woman's brain cells while we're increasing the blood flow and decreasing the inflammation, because these exosomes go right through the blood-brain barrier. These are excellent options for chronic inflammation, autoimmune conditions, and brain fog. Okay, so if you're thinking to yourself right now, well, what about this condition? Yes, I'm talking about that condition. There's just so many that this applies to. Again, we're not healing anything, hey, but we're helping regulate that inflammation, and we can regulate that inflammation. That's where we're going to make the biggest difference. This is non-invasive, it's fast-acting, and well-tolerated. In fact, we've actually had some people nebulize at home. So here's what to expect. You could be like my man James here. When we injected James' knee, it was bone on bone. He couldn't sleep. The day we injected it, that night, he slept very, very well. So doing it the way we're doing it, we're now seeing people get relief in 1 to 2 days, up to about 6 to 8 weeks. 6 months is on the long end of things, but you do see results pretty quick. And then the long-term results, of course, are going to vary, because that's just patient to patient. So for best results, this is what I'm going to tell you. Now keep in mind, I put another picture of my dad in here. Again, those are knees that are supposed to be replaced, but he's now pushing a wheelbarrow in that picture. He didn't listen to me for anything on diet, okay? Just to be clear. And I think that was actually a big part of his demise. But here it is. If you want the best results, then you want to do an anti-inflammatory, high-protein diet. Now, if the thought of that blows your mind, you don't know what to do, don't sweat it, because if you work with us, we will custom build one for you, so you'll have a meal plan. Hey, light movement, collagen, I missed that one. You do want to supplement with collagen. We do not want to grow new collagen, whether that's type 1, type 2, type 3, type 4. We do not want to grow new cartilage based off of consuming mac and cheese, pizza, and Doritos. We want collagen built off of collagen. There are some very good supplements out there. I don't really gravitate towards one or the other, but I'll give you recommendations as far as if we see you one-on-one. And then light movement for the next 2 to 3 weeks, meaning do your activities of daily living, just take it easy. Use some throttle control, don't go ham. And that's also going to depend on the patient too. If you're an athlete, that looks completely different than if you're a couch potato. So you do want to avoid twisting or loading for 8 weeks. So I will say this, skiers, don't do this in November, do this in April, because I don't want you to miss your season. Okay, mountain bikers, clicking out of your pedals, that becomes problematic. So we'll just talk about how to best do that as far as the season is concerned. But just remember, healing isn't passive. You're part of the process. Okay? You have some say in how this works by how you take care of yourself. So that brings us into the new era of healing. We no longer have to be like Michael Scott, where we're trying to just kind of stick our foot in the MRI machine while Dwight gets his MRI. We don't have to do that. Okay? We can now rebuild tissue rather than replacing. The whole thought of not growing cartilage after a certain age is just not, it's not viable anymore. We know that can be that wrong. So it's all about immune system modulation, decreasing inflammation, signaling repair, and restoring that tissue. So reclaim your health without going under the knife. These injections start at about $650. So are you a candidate? That remains to be seen. Okay? You can visit our website at truecorelabs.io. You can call or text us directly at 208-218-8622. Let's talk about your options. Don't settle for surgery before we talk about regenerative healing. I appreciate your time and your attention. I'm here. Please feel free to ask questions.